Hello everyone, my name is Realyn Fortin and today I will be discussing Hutchinson-Gilford progeria syndrome. First, let's discuss what is progeria. Progeria is also known as Hutchinson-Gilford progeria syndrome or HGPS for short. It is named by doctors that first named the disease in England, and they are Dr. Jonathan Hutchinson and Dr. Hastings Gilford. The name comes from the Greek words pro, meaning premature, and geras, meaning old age. Together, the word forms prematurely old. Progeria is extremely rare that causes a dramatic aging in a child's body. Children with progeria looks healthy and normal when born. Within a year, they start to show signs of the disease. The most noticeable symptoms include slow growth rate, weight, and height. Their weight is less and their height is shorter than the typical for their age group. Other symptoms include baldness. Individuals with this disease begin to lose hair in all areas of the body, including their scalp, eyebrows, and eyelashes. They also have a bigger head in comparison to the rest of their body. There is also a frontal and parietal bossing of the cranium, or the skull. Visible veins can also be seen through the skin, which is another symptom of the disease. Beak-shaped nose, or in other words, small pointed nose, is another one. There is also a delay in the formation of the primary and secondary teeth. Lastly, age spots can also be seen all around the body. So, what are the causes of progeria? Back in 2013, researchers of the Progeria Research Foundation, the New York State Institute for Basic Research in Developmental Disabilities, and the University of Michigan have discovered that a certain mistake in the LMNA gene is a culprit. Progeria is caused by a mistake in the lamin A gene that causes it to produce an abnormal protein called progerin, which is how this condition got its name. The gene is responsible for keeping the nucleus of the cell together, but when there's a mutation in the gene, the cells become unbalanced and the cell's nuclear membrane is damaged in a way that it is unhealthy for the tissues. This is the reason why children grow extremely fast. This diagram shows chromosome 1 where the mutation would have occurred. With further research, it was discovered that this mutation happened mainly during the DNA replication during the process of meiosis. Because symptoms of progeria can easily be noticed, pediatricians can spot them during a checkup. Checkup may include measuring height and weight, testing vision and hearing, and analyzing pulse and blood pressure. There is a genetic test that is currently available. The signs and symptoms of progeria with a physical diagnosis are not visible until the first or second year. This genetic testing allows healthcare professionals to test for LMNA mutations to confirm progeria. Currently, there are no known cure for progeria, but there are treatments that can help with the signs and symptoms. These include aspirin, which may help prevent heart attacks and stroke. The doctors can also prescribe other medications that can help lower cholesterol levels and reduce the chances of blood clots. Growth hormones can also be used to help with the child's weight and height. Physical therapy may help with joint stiffness, hip problems, and other physical related problems. Nutrition. The child needs to stay healthy and eat nutritious foods. Dehydration is more common to children with progeria, so ensuring the child drinks lots and lots of water is crucial. Dental. A delay in tooth formation or tooth decay is one of the most common issues with progeria, and taking a proper dental care will help with tooth formation. Regular doctor visits. Doctor may check for vision, hearing, and dental for any changes. Assessing and monitoring for any signs of cardiovascular diseases may help with treatment. Surgery. Some will require coronary bypass surgery to help ease or delay heart attack or any diseases. Among the complications associated with progeria are diseases that are usually accompanied with old age. These include cardiovascular diseases such as a heart attack, cerebrovascular issues such as stroke, scleroderma, which is a condition that hardens and tightens the skin and connective tissues, loss of hearing or sight, delayed tooth formation, extremely fragile bones, and an abnormal skull structure. Hutchinson-Gilford progeria is an autosomal dominant condition, which means that the copies of the genes of the parents are normal, but the abnormal gene still dominates. This further concludes that the trait for this condition is neither dominant nor recessive, since it was not inherited from the parents. Researchers determined that none of the relatives of the child absorbed had any signs of the abnormal gene. In this case, progeria is an extremely rare case, which affects 1 in every 4 million globally. There has only been 130 reported cases since it was first described in 1886. Progeria also affects both men and women of all races equally. That concludes my presentation. Thank you.